the neck wedge-shaped abrasion also, it's a really good sign to understand what is going on with the mandible. Also the bony part, if you can see exostosis on the vestibular surface, you can just see sometimes you can find the exostosis on the front area. Sometimes you can see only on the lateral area, but one side. But what is it? Why the patient has got some kind of exostosis in the mouth? So the answer is because of the forces. If the muscle forces on the right and left side is not the same, you can just realize that one side, the exostosis, it's much more seeable than the other side. And also, you can see the wrinkles and the muscles on the patient's face, and you can see the posture as well. It's obvious if the mandible as a part in our body system connecting the other body part with muscles pulled out from its position. It's obvious this pull the face muscles, the neck muscles pull the shoulder muscles, and the shoulder muscles pull the other muscles. So completely make an effect on the whole body system and the body muscle system. So you have to keep in mind this kind of information. So all the information, this huge amount of information that you can have already collected from the face, from the posture, from the muscles, from the mouth, you can use from making a diagnosis and creating a diagnosis regarding the given position of the mandible. So I will show you a lot of details about that. But if you make, so this is a very important thing, if you make a really nice smile, you have to use all of this knowledge and this kind of diagnostic. So the diagnostic belongs lines and muscles as well. And if you put the lines and muscles in an individual way on the patient's face, you can get a really nice result because you are able to set an individual occlusal plane on the patient's face. This can be done with the Smiley software in a very easy way during minutes. So as you use this line way, I will show you later, you can get immediately the right occlusal plane, and you can place the teeth in a conscious way on the patient's mouth. And the result, 100%, so you will get at least 90% correct position mandible, so the function will be correct. The posture will be correct because the mandible in its proper position in the body system, and you will get a really nice face aging, positive face aging effect because all the muscles relaxed on the face are relaxed on the face. So these are the guaranteed results of Smilist. If you would like to create a really nice smile, you can see on the left side picture that the patient's head is very quadratic. You can see aging effect. You can see a quadratic form, a deep nasolabial wrinkle, a deep smile line, a reverse smile, a double chin, a lot of other things. In the middle, you can see the stage after gluing the veneers and this tabletop system. And in 2 weeks, you realize that the patient is completely changed, 10 years younger face and 10 years looking, that we can guarantee to all of our patients. Of course, we can create a really nice smile. And this is a positive side effect that we can get a really nice, and we can achieve a really nice face aging, positive face aging effect. And of course, the posture balance and the Fox function is also really great. So this is the first paradigm shift that I made, and I'm very, very happy to share with you that you have to use all your knowledge and all design from the face as one packet. And using this packet and using this knowledge and trails, you have to find out the
Yeah,
real
you're muted again.
function as well. So from now, you are able to see the patient as a whole system and the mandible and smile as one part of our body, so which is really great. So the Smile is new approach, step by step, I try to show you how we should look at the patients. First of all, you have to collect the information. I have already told about that. If you look at this face, you can just realize that maybe this midline is not correct. We've learned about a lot the midline system. Midline system try to create the glabella, tip of the nose, philtrum and the pogonium point, and try to place on the patient's face. But in 95% or more than 90%, you are not able to place this the straight midline on in a correct way on the patient's face. And the question comes immediately, are all faces symmetrical? And if you see this face, you can just cut it in the middle as you place the middle in the glabella, tip of the nose, philtrum, and the pogonium point, and you can realize that if you doubled the left side and double the right side, you can get immediately two different faces. So this face is not symmetrical. Why we should use and why we should use in our dental work a straight midline system. This came in mind and I thought it is not correct. So I try to use the straight midline concept, and I use this line as usual. You can find in all of the books. I made an extra lines, which is the tragus tragus on TMG TMG line. And I realized, and we made some kind of research with Dr. A.J. Kakar in India and in European population, that is really right. Only 5% of the patient has got a straight midline. So our dental work in 95% maybe goes in a dead end. So it's another good result at the beginning, knowing at the beginning that the end result 95% will be questionable. So if you see my face and try to place the line, glabella, tip of the nose, philtrum and pogonium point, you can just realize that all the line not parallel to each other, and my midline is not straight. If I place the right midline and draw really a line that you can get from my face, you will realize that my midline is the slope one, not a slope one, but a curved one. We have a slope midline, of course, but in this case, the line that you have already placed on my face converges to one side. And this converging side is absolutely can be seeable on my face as well. And the midline in this case, in this individual case, is curved. This curved midline should be used for the dental work for all the time. If you see the three variation of a midline, there are some population that slope, there are some population that the curved midline is most popular and can be found in a bigger percentage. But you can see that if you use the straight, the slope and curved midline, you can just realize that the occlusal plane is completely different from each other. So if in a curved midline face patient, you try to use the straight occlusal plan, it's completely wrong and incorrect aesthetic and function will lead. So if you see the lower picture, you can see that one. I try to show you this area on the front incisors. The front incisors and lower incisors, these should be contact regarding the setted occlusal plane. The occlusal plane, it belongs to a different individual faces and the given straight, slope or curved midline. So this is the first things that we can realize. For example, is in this before-after pictures. If we would have used the straight midline, this lady function and the aesthetic wouldn't have been so nice and functionally great. In the middle, just you can see the face with lines and curves, and this lady has got a really nice curved midline. Therefore, the occlusal plane set it in a canted way, converge to one side, so to the right side. So the aesthetic, it's really go hand in hand with the function as well. We have a lot of articles about that one in my language and in English as well, so you can read um, in it about that. And the next paradigm shift is in the dentistry, so the midline. So if you listen to this lecture, try to look at the face, glabella, tip of the nose, and philtrum. Philtrum, not mentioning the Pagonian point because the mandible could be shifted and rotated to left and right side. So with the help of the software, you are able to set the mandible in its proper way by at least try to place the lines through the eyebrows, through the big pupilla, nostrils, and ICL, and you can get some kind of parallelity and convergity. And after that, look at the glabella, tip of the nose at philtrum, and try to find out what is going on. So the straight midline, slope, or curved midline, and it could help you to set the occlusal plane and create a really nice and correct canine position and canine lens, which is really the key of the perfect function. So the novelty of Smiley's midline system, it's that is really individual. So if the patient has got a slightly curved or strongly curved face, the occlusal plane, individual occlusal plane, is completely different from another patient as well. And what is really nice with the software that you can use a customized and digital Facebook system and midline system as well. So you don't able, you shouldn't use anymore Facebook because there are a digital one as well. So this is the software, and in the middle you can see the midline system here. It was my midline, which was curved. On the red, you see the occlusal plane, and as a silhouette on my face, you can see the right position, front incisors, canine, and premolars. And on the left side, you can see there are some missing teeth part and missing part from the edges. So it has to be corrected because it makes an effect on my face muscle, on my function, and on my head posture as well. So we will speak about later, but at least with the help of the software, you are able to create a diagnosis and create a proper treatment plan and showing the patient and showing the dental technician what is going on with the teeth and with the function. And if you see the function and aesthetic, it's hand in hand. That means if you look at the aesthetic, okay, left side is a missing part aesthetically, not only functionally. So it's very, very important to know about that. So aesthetic and face geometry. This is the next finding. If you would like to create really nice smile, because we are speaking about at the moment the aesthetic and the side effect is the functional part, you have to create a conscious combination of a smile. Actually, there are more than 60,000 combinations of a smile. There are exist all over the world. So that means so the front incisor, second incisor, the canine, the inclination, variation, it comes more than 60,000 combination. Therefore, I try to find some method and some rules to use it and to share with my student as well and with my colleagues as well to be able to design a smile in a conscious way. So if you look at this face, you can just see the face as some kind of geometrical collection of anatomical structure. For example, the nose is triangle or trapezoid. The upper lip, it's a butterfly. The lower lip, it's upwards curve. The cheekbone is really oval. The forehead is trapezoid, and all the face are trapezoid. So these are geometrical elements that you can use. If you look at these stars pictures, you can just see some patient has got an oval form, face form. Some patient has got a quadratic, an upwards triangle, an oval, squarish, trapezoid, and a lot of other form. But we won't see uh, only the face form and the head form, but look at the anatomical structure as well. You can see on the top a man face with drawings and a female face with drawing as well. The man face is with lot of oval elements and lines, and the female face with lot of quadratic elements and trapezoid elements. Even if the man, even if the person is a man or a male, you can use an oval element depending on the face structure, face geometrical structure. And if the patient is a female, with quadratic elements, you can use quadratic elements in the smile to make the smile a little bit harmonious to the face structure as well. If it would be a really nice exercise for you, if I would be your patient tomorrow, for example, I'm very annoying patient because I'm really exciting about the details. And I ask you to design a smile and choose a smile for me, especially for me, and choose only one smile that is really matched to my face, to my character, to my anatomy, to my personality. Maybe you will be a little bit scared. More than 60,000 smile types that there are exist, and our aim is to choose only one that matches to the personality and patient's face. And what is really interesting, if you see the face as a geometrical collection of the anatomical structure, you are able to do this in a conscious way. I try to show you how. For example, if the patient has got only a nose without any columella. Columella here in the middle, it's a longer part of the base of the nose. And if the patient there isn't any, there hasn't any columella, you can just place the teeth, so the front incisors and second incisors, without any step. If the patient has got a columella in the middle of the nose, so you can see all the stars has got a nose with a columella, uh, choose a smile with a step. So the front incisors a little bit longer than the second one. And if you see all the picture, you can just realize, oh, these two lines, so the base of the nose and the contour of the second and lateral incisors and the first incisors is the same. So it's amazing. So you will be a magician, and you're going to be a magician if you follow these rules. But this is only one rule. We have 8 rules to create a really nice smile. We have 8 parameters. Of course, you have to do how to use these 8 parameters. But if you see in a logical way, we can use the front incisors, the lateral incisors, the canine shape, the incisor edge configuration, the inclination, the incisor curvation, and of course the vertical dimensioning, the so-called smile type. If the patient has got a longer front incisors and a shorter second incisor, that means the effect, it's a little bit attractive or sexy. It's mainly for women, but there are a lot of men with this columella and the same effect. And we have to use this kind of step as well. So if we see the face as a geometrical map, and if we use the 8 smileys parameter and match to each other, you can find out what's the perfect smile for the patient. And this smile will be 100% individual. So this is one key, that the individual tooth characterization now based on objective rules. So if you would like to design a smile for me, you have just look at my base of the nose, so it should be a longer front incisor. If you look at my nasolabial folds, we have to use the same characterization of the canine. If you use my narrower lower part of the face, you have inclined the premolars and molars a little bit inwarded. So this 8 parameter, you have to learn how to use it, and you are going to be a magician 100%. So this is a so-called wide aesthetic conscious pre-planning, so the WACP technique. With AJ Kakar, we have already published an article about that. He helped me a lot about writing articles and writing also a book, and share with you this knowledge in India and in all over the world. So despite aesthetic conscious premiere planning means you are able to design the white aesthetic, so the smile in a conscious manner. So it's very, very important to know that we have 8 parameters from the first incisor till the inclination, and you have to only match to the patient's geometry individually. It's very, very easy. And you see the software, which is really useful because it is 60,000 combination of a smile. You are able to switch and only just click on your screen if you have a screen like that one, or you can just use your mouse and switch on the tooth lens, so the parameters, so the central incisor shape, the lateral incisor shape, the canine shape, the incisor curvation, everything. And if you see in the middle, you can see the midline. With red line, you can see the positioned occlusal plane. Actually, the software more or less plays this occlusal plane automatically. So you have to set a little bit, but actually this is automatically placed on the face. And now you can see the midline system, so which is curved and all the line converge to right side, right patient side. And you can set the teeth in your design manner. That means you have to choose the 8 parameters based on consciousness, looking at the face as a geometrical structures. So of course you have to learn to do it, how to do it, but it's very easy to use the software. If you use the software only based on your emotion, you can just do it, because actually if you have a great sense to the nice thing and harmony, you can just realize, oh, on the left side there is some missing area on the canine, so I will make teeth a little bit longer. And therefore the aesthetic, it's really nice, really nice things to know about the functional things as well. So if you see this red circular things, you can just realize that here is some missing area on my left canine. Therefore, there is no any canine stopped on the left side. That means this left canine won't stop my mandible. Therefore, my mandible goes shift and rotate towards to the left side, which is actually functional things and functional issues. But from the software show immediately that you have to treat the canine and the left side lens of the teeth, because it will lead some kind of functional problem, but not only in the occlusion and gnatological part, but on the whole body and the face as well. So with the software, you are able to measure everything. Everything. You are able to draw the gum line and measure how millimeter is needed to lengthen the crown towards to the gum or towards to the incisal edge. So it's very, very useful communication with the dental laboratory, and convince yourself as well that the gum surgery, it's only 0.5 millimeter, which is not a big deal. So you can just do in your own way without any big surgery. Okay, here is the Smiley's Lab software, which is the next step, how to create Smiley's in a conscious way, in a three-dimensional way. If you take an impression digitally or analog impression, you can just use for a CAD/CAM system. There are some very important drawing to the dental laboratory. Maybe you want learn about that, how this software should be used. Only just look at the method. So if you have already designed a really nice smile, you can just send this design to the dental lab, and the dental lab will use our three-dimensional toolkit and immediately place these teeth in the patient's mouth with the help of all the lines that you have already placed on the patient's face and the occlusal plane as well. So you should be know that you are sure about that the aesthetically designed smile will be really good functional part as well. You see here the three-dimensional CAD/CAM picture as well in the two-dimensional picture. So it could help the dental laboratory how to set the maxilla, how to set the teeth in a proper way to get a really nice function regarding the curved midline and discounted occlusal plane. So it's really important to know about that. Without this digital design, I'm sure 60 or 70% of your work can be go into the dustbin. I'm sorry to tell this one because my work was also the same. But if you know these things, you getting a better result and a conscious result in the future. These are the picture that we can send you to the dental lab with a gum line imitation, with a contour imitation. And in this case, the dental laboratory technician can see the contour of the teeth, the lengthening effect, the midline, and so it's a really great software to use in the dental laboratory work. So this is the three-dimensional toolkit. So the dentist and the dental technician can be used after designing the smile in a very easy way. So in a CAD/CAM system, you want deal with the designing that is one-to-one because you will get all the kit of the design smile immediately. So this is the design smile. So you can print it out, you can use for a mock-up, you can use for a temporary crowns or making some kind of silicone stand to make a dairy bonding veneer, and we can use a lot of things, but this will be a really correct setted temporary or final work. If you use a digital setting, you can just realize that you can use an articulator and you can imitate the chewing effect and of course all the other setting digitally as well. And after that, you can use a T-scan or other method to measure the pressure on the teeth both sides to convince yourself and check the work after gluing or after the temporary fixing of the design smile, which is really important anyway. So with the Smile Design software, you can generate instant picture, before-after picture to the patient and for the dentist, dental laboratory as well. So you can see immediately the differences, the before and the after picture. So the Smile is next paradigm shift is if you have already collected all the information, you will realize that no more averageness that you should use in your dental practice, because from now you are able to use the customized rules and the WEC the technique, the customized midline system and setting the occlusal plane in a customized individual way, which is really great because no more dead end, your work became much more conscious and the smile and the outcome of the invention much more reliable than it has been now till now. So looking at the face, more and more details can be seen. So not only the anatomical structure, not only the midline, but we can see the muscles and the wrinkles as well, which are really great and important signs from the face. Three main muscles can be seen on the face. So the zygomatic muscles, the masseters, and the mentalis or mentalis muscles on the tip of the face of the patients. And the wrinkles that can be seen, the nasolabial fold, starting from the nose, going down to the cheek. This is the wrinkles under the eye. This is the wrinkles on the chin. And this is the mentalis wrinkles on the mentum of the patient. Why we should use this kind of signs and why we should collect this kind of information from the face? The answer is very easy. If you collect this information immediately after the patient comes into your office and sit down in the chair, you can just realize, oh, Right side muscles, masseters a little bit bigger. Left side zygomatic a little bit flatter than the other side. Oh, the mentalis is hypertrophied, but why? Oh, look at the wrinkles. The right wrinkles under the eye, it's higher and circular. The other side, it's a little bit lower and triangular. But why? And if you think in a logical way, you can just realize because of the mandible. I have already mentioned that the key of our work and our well-being, anyway, is the mandible. If the mandible not in proper position, it won't be really nice, the aesthetic, okay, but it won't be really good, the function as well, and the face aesthetic. So if you pull the mandible forward or laterally or rotate a little bit to one side, it would be this movement as it would pull out the spider from the web, and you will just realize on one side a little bit overstretched, the web and the spider web, and the other side it's getting a little bit loosey. The muscles on the face and on the body is working the same. If the mandible, because of the maxillarities, won't hold in a proper way and won't create any stop frontally and laterally, the mandible goes forward or laterally and pulled from the muscles from the face, first the mimic muscles and then the chewing muscles, and make an effect on the body part as well. No, in the next coming slides, you can see how it can be seen on the face. So on the face, you can find a lot of muscles. Maybe that you can learn it. It's a zygomatic muscle, masseters, and the mentalis muscles. These three muscles, it's enough to create a diagnosis regarding the mandible. Okay, let us look at the muscles. If the mandible goes a little bit forward, immediately try to pull the zygomatic muscles. These blue arrows show you the direction of the pulling effect. And the patients became really getting really flat middle part. And then the depressor started to pull down all the lips, so the angulus of the lips, both sides. If it's asymmetrical pulling, of course, one side it's now deeper, the other side is it's higher position if you look at the patients. And the mentalis muscles, to compensate this kind of stretching, try to push up the lower lip to the upper lips. Therefore, the patient lips will become a little bit thicker, and it's not too nice and not too aesthetic. And you see here around the lip, vertical lines as well, or a star-shaped lines on the lower area, mentalis line, deep nasolabial wrinkles. So not only muscles changes, but the wrinkle changes as well. So these are the really good sign, because every single dental and mandibular problem has gotten or symptoms on the face. You can just learn it, and you can just find out what is going on if the frontal incisors are a little bit or are seriously proclined. This proclination pushed away the upper lip, of course, and allows the mandible goes forward. Therefore, the pulling effect on the face from the zygomatic muscles and from the lips started, and you can see a sad and a tired face, even if the patient sleeps a lot. So this protruded mandible and proclined front incisors can make an effect on the muscles, and this will be the typical effect around the lips, creating a really nice hypertrophied mentalis muscles with mentalis folder shape wrinkles. And this is what we can see immediately if the patient steps into our office. So if the mandible rotated one side, because of the right canine is outstanding. You see here the right canine of the patient is outstanding, therefore allows the mandible shifted right way. Smile is has got a new nomenclature. Shifting can be seen from the front, but rotation explain what is going on with the mandible. So in this case, the mandible rotates towards to the right side. So the tip of the mandible position towards to the right. Therefore, we won't use setting the midline system. So never use the pogonium point to defining the midline system. We are the dentist and we would like to set the pogonium point and the mandible in its proper position. So if the mandible rotates to the right side, you can just see that on the left side muscles will become huge because this area will become a gap between the upper and the lower jaws and the teeth. Therefore, the muscle starts to work in a stronger way. And this causes some kind of hypertrophy on this area on the muscle on the left side. On the right side, of course, there is some kind of hypertrophy because the mandible rotating not only to the right side but shifted forward as well. And you can see here some kind of hypertrophy as well. But the differences between the right and left side can be seen in a very easy way. If you see the folders, nasolabial folds on the right side, it's closer to the horizontal. On the left side, it's closer to the vertical. That means the patient has got a right way rotated mandible. Think like an inspector. If you push the mandible and rotate towards to the right side, it's obvious that the left side muscles and skin pull down, and the right side it's a little bit loosey and overstretched, and therefore the wrinkles it's also banded a little bit towards to the right side. The right nasolabial fold a little bit closer to the horizon, and the left it's closer to the vertical axis. So if you set the mandible in its proper position, immediately disappeared. Immediately means in my mind that during 2 weeks or something like that, you can see the differences. Immediately you can see anyway on the folds as well, but on the masseter it needs maybe 2 weeks till 2 months that it's became a really nice contoured and symmetrically positioned muscles. Okay, here this can be solved with non-prep veneer technique and tabletop system. And if you see the double chin, which is the biggest problem of the women's, it's completely disappeared. So this is the method that we would like to use to set the mandible and creating the patient's face really 5 or 10 years younger, because all the muscles start to work in a normal way, normal and relaxed way. So in a relaxed position won't be so stretched and so stiff, but in really relaxed. Therefore, the hypertrophy disappeared, and this flat area, it's absolutely became bulky and getting bulky by the time. So this staging, positive staging, aging effect, that means reducing the patient's age minimum 5-10 years. Maybe from starting immediately after gluing the veneers, and during the next upcoming 9-10 months or almost 1 year, make an effect on the patient's face, patient's blood circulation, the patient's tonicity of the skin. So you can see a magic on the patient's face really. And if you know this technique, how to do this, how to set the mandible, I will show it later, how to set the mandible in its proper position, you can guarantee the patient that kind of effect. So from quadratic face to an oval face, from almost 60 years looking ladies for a 45 years old looking ladies, your guarantee, it's absolute perfect. And not even in a female, but a male patient as well. If you set the mandible with tabletops, design the smile, of course, look at the midline system, look at the geometrical elements on the face to create an aesthetic part. setting the mandible in its proper position, you can immediately see that, for example, that the zygomatic muscle starts to move in a normal way, and by the time it's getting more and more active, and the other muscles in a relaxed way. So this is the so-called gnato-aging technique, which is also very popular among the patient. And if you do it in a conscious way, not only concentrating on this beautiful smile and creating a really nice and wide smile with veneers, but really concentrating on the function as well, you can achieve amazing results, really. If the midline and the occlusal plane not set it in a smilist way, you can get a functional problem and immediately a muscle problem on the face. So one side pull down effect, the other side is the push up effect, which create asymmetry on the face, and by the time, over the time, you can get hypertrophy on one side and flat area on the other side. If you want to do this, you can get this kind of results. So this is a before and after picture. You can use a direct veneer technique. This was a direct veneering technique. If you see the before and direct rebuild it teeth, and of course this is the before and the after picture, a much younger looking face with a minimum additive composite technique. Okay, this is also aging technique, only that example. The woman suffering from sad dog eyes and this old looking face after the auto treatment, because the gnatological setting and the mandible settings was not correct. If we have already set the mandible, all the muscles started working a normal way, and disappeared the double chin from the quadratic face. We got a relatively oval face from the flat zygomatic area. We got a really nice and rebuilt middle part area. So this is the next paradigm shift of smileys that I really like and enjoy for doing that. So no more averageness, no more average smile, no more average function. And if you use and follow the smiley step-by-step method, concentrating not only the midline, not only the WECP technique, but concentrating on the muscles as well, you can get a really nice result, and you can guarantee the patient this 5-10 years younger look. So again, so the aesthetic and function go hand in hand, but I may say not only the aesthetic and function, but the face beauty go hand in hand and together. And if we go deeper and deeper, and I give you much more understanding about the smileys, you will realize that all the things go hand in hand. So not only the aesthetic, the function, but the body part, but the pain, but the bloody circulation, and our well-being and energy system as well. So the next step, it's aesthetic and function again. It's a lady after ortho treatment with a premature contact, with a lower smile line, a flat middle part area, nasolabial winkle, right verticulated mandible, hypertrophied mentalis, and after the treatment, you can realize that all these signs disappeared, and the mesial part from the flat zygomatic area getting really bulky, and the upper lip, it's getting a little bit positioned higher. So the smile is completely changed. And of course, the mood of the patients. This patient was very, very depressed about not chewing and not looking in a right way. So therefore, with non-prep and slightly and very mild preparation, we can achieve this kind of result on her face, and of course on her posture as well. And this is the next thing. I mentioned you that if you collect all the information from the face, design everything regarding the midline, individual anatomical structure, you can get a really nice function and a really nice individual function, and the result will be a great posture. I mentioned that when you try to imagine the mandible as a spider in the middle of a web. If the spider will be pulled away laterally, for example, the left side will be getting loosed, the other side will be overstretched. The same as our muscles on the face and on the body start to move immediately if the maxillary teeth on the front and laterally won't hold the mandible. If the front incisors and lateral incisors are too short and allow the mandible rotate to left side or upward, you will realize immediately on the face as some part of the face getting flatter, some part of the face hypertrophied. And if you see the neck part and the shoulder parts immediately react on that movement of the mandible. And for example, if the mandible rotates to left side, the left shoulder bended forward and the head tilted left side. So if you look at the patient with some kind of symptoms, you can just realize, oh, this patient has got a left waist rotated or a right waist rotated mandible. Anyway, if you see on my picture and the screaming my head posture, you have to find out my mandible in which side rotate. Maybe you send me a message on the Facebook or via Messenger, and I will send you if it is correct or not. I have also a problem, but I treat on myself as well. So let us look at the negative cascade effect. So if you look at the posture, you have to know that we have a body with body muscles, and on the muscles covered the organs, so the organs covered by the body muscles. The bony part is hold all your posture, and we have also the energy system. We can speak about the vessels, the oxygenization, the nerve system, the lymphoid system, but this belongs to the energy as well, or the chakras or something like that. It's a hidden part of smile. I'm not going to speak about that one, but let us look at concentrating on the negative cascade effect. If the mandible goes away from its position and moves forward or laterally, immediately elongate the muscles and make an effect on the muscles, on the chewing muscles as well. So the patients start to clenching, for example, or start to feel some kind of migraine. If the mandible moves laterally or the condyle moves away from its position, and for example, the left condyle is pushed the fossa, the right condyle comes out from the fossa. Therefore, the patient may feel some kind of tinnitus. So the migraine, cervical spondylitis, neck ache, or restricted hand movement is all of the negative cascade effects, step-by-step stage, or the backache. And if you're concentrating on not only the muscles and the bony part, but on the organ as well, so the inner organ as well, you can see that, for example, a distal-rotated mandible closed and pushed the tone to the narrow part, and therefore the patient feels some kind of acidity because this sign means to the brain, or food is coming, so please produce acid. And the patient with an upwards rotating mandible feel continuously that one. So I have an acidity in my stomach. And the reduced vital capacity, the unilateral knee pain, and early onset aging on the face and on the body as well, body posture as well, you can realize as a negative effect on the muscles, on the bony part, on the muscles part, and on the organ as well. And on the face, you can just look at it immediately, but on the posture as well. So I have another really important knowledge and diagnostic effect in your hand. If the patient comes into your office and look at the posture, his or her posture, you can realize the head posture, the shoulder position, the knee position, or the feet position as well, and you can create your diagnosis regarding the mandible. So it's very interesting and easy. So you can find out what is going on in the mandible, and you convince yourself if you treat the mandible problems and set the mandible in its proper way, you may solve, or you can solve this kind of problems on the body, on the muscles, and on the inner anatomical structure, or for example on the knee as well. So this kind of problems, migraines, acidity, backaches, knee, or loss of breath because of the mandible elongate the muscles and make a distortion on our posture as well. Now you can see some posture problem with the patient. These are nudie, goosey, baby on posture, hipster posture, or on guard posture. These are the posture, how the posture compensate to a mandible dispositioning. For example, if you look at only this nudie posture, is a resultant of an over-rotating mandible, causing the neck to protrude forward position. And if you see, the jelly belly started immediately. So if the patient has got a jelly belly, even if the patient is very small, it's funny what I'm going to tell you, but you can immediately know that this patient has got an over-rotating mandible. And if you will set the mandible, all the muscles set the posture in a correct way and make an effect not only in the function and not only in the neck, but on the jelly belly as well. So it's really funny that we can treat the jelly belly as we can treat the double chin on the face as well. So for example, the nosy posture is caused due to the body balancing itself forward at the top due to an upwards displaced mandible. This is also a compensation. It's like really the head goes forward, and this patient suffers from um, nerve ache in the stomach, so frustrating all the times, because this lean on position try to hold with the stomach muscles. So if the patient has got a stomach problem constantly and feeling some kind of anxiousness in the stomach, but we don't know why, please look at the upwards rotated mandible and treat the upwards rotated mandible with splint or with smiley positioner or with definitive treatment, and it will disappear immediately. Okay, this is a goosey posture. It's the compensation with the chest and the breast up and the butt back position. This can get some kind of balance to the patient. Of course, also some kind of problematic mandible. If we know the negative cascade effect, there must be a positive cascade effect as well. So if we if we would have a method, and it may we have at the moment, so if we would have a method or a positioner to set the mandible in its right position, our aim in our thinking in a logical way, that we are able to make an effect all the body system, all the posture system, the knee problem, the neck problem, and make really a great solution on it. So look at this, wait a little bit, I'm not able to. Okay, I try to use this video. No, it's not moving in a conscious way. Wait a little bit, I try to show you like this one. Oh, I'm not able to start the video.
Oh.
Oh.
Try again, Maria.
Yeah, I try to escape because it's really important. Wait a little bit. I try to share my screen like this one.
Yes,
And
it's too small now.
yeah, I know. Maybe it's bigger now.
Yes, it's big. Play. It is playing
And
now.
if you see on the left side, you can just see how humble this patient with an duck shape form. And this is how he is able to move and walk at the moment. And after placing the stabilizer and using the stabilizer, you can realize how quickly the stand-up movement and how quickly and smooth the walking as well. So again, only just to remember, this is the stand-up movement. We lean on the chair with one hand, and this is the walking effect and the walking movement. Okay, and the other videos you can just see how quickly the stand-up movement and the walking, because this patient has already been deprogrammed the mandible with Smiley's method. This is what I would like to speak. So this the programming method a little bit later. But
We
now
have only
you
10 more minutes.
have to know that the importance of the front incisor is really, really big. If the
Maria,
front,
10 more minutes.
yeah,
10 more minutes. 10 minutes more.
yeah.
10 more minutes.
Yeah, thank you. I know. I look at the time, so I'm in time. So the importance of the front incisors is very, very important. And therefore the occlusion, what we can see in the patient's mouth, it's really an illusion. So we are the dentist. We should look at and we should collect all the signs from the face. We should set the mandible in its proper way, and we should create the occlusion that cause a really nice balancing effect on the face and on the body posture as well. This is also a movie, a patient who was not able to use the stairs. Therefore, his family sold out his house and bought a new one without stairs. And now after deprogramming and using the stabilizer, this patient is able to move up and down on the chairs, which is really amazing. So this 35% deprogramming, it was really uh, complex cases. So after 35 minutes deprogramming, this patient is able to move. So the paradigm shift is the role of the maxillary teeth and role of the setting the occlusion. And if you create a really nice fence and stopped on the front and on the canine with the help of the software drawings and lines, you can get a really nice function, but not only gnatological function and the occlusion, but regarding the whole body balance. So the Smiley's bite and the deprogramming. So if you learn this kind of method, you're going to be a magician, I'm sure, because you can guarantee to your patient a great function, a TMG solution on all the clickings, all the pain, all the stiffness, all the hypertrophy, and you can get a really nice face rejuvenation as well. So I ask you to learn this method to heal your patient like Smiley's way, because it's really unbelievable day by day to realize that kind of result immediately in your patient's mouth. This is a really good example. If the patient has got a curved midline, you can see on the left picture, this is the real Smiley's midline, goes through the glabella, tip of the nose and the philtrum, and actually goes through the given pogonium point as well. And this is the placed and designed smile setting according to the curved midline. If we're using a straight midline as usual, according to the book, you can just realize that the occlusal plane should be parallelized to the bipupilla or to the ICL. If we parallelize to the ICL, we can get a canted smile to the left a little bit. It's not the same as we have already designed. So on the left side, the canine will be a little bit shorter, which leans functional problem as well. If we use a bipupilla, as we have already learned, to do it, you can get a much more counted occlusal plane and a much more functionally incorrected setted canine and occlusal plane. If we see the condyle position as well, in the first case, all the condyle is in the fossa, which is right, no pain, no functional problem, no clicking, no more additional problem. In the middle, if you use the straight midline, parallelize the occlusal plane to the ICL, slightly clicking, slightly TMG problem, and slightly changing on the face. But if you use the bipupillar line, as we have already learned and we've been using for several years, you can just realize that the patient immediately or 2 weeks after the fixing complaining about some kind of pain on the TMG or soreness or clicking and other problem, neck problem, face problem, aging problem, and a lot of other things. Now you are able to treat this kind of problem as well. This is how we make the deprogramming. You have to learn how to do it. I'm sure we are going to have a lot of courses organized in India, EJKKR and the other association in India to learn how to take the smiley spine in a conscious way. Maybe 2 or 3 days courses, it's enough to learn this technique and make the patients really a really nice solution. So for example, this is a deprogrammed mandible. We can immediately get the relation between the upper and the lower jaw. So my aim is to get the relation between the upper and the lower jaw, and I am the dentist. I will rebuild the teeth as it should be rebuilt. So you have to understand that the occlusion is illusion. It's by the time and over that time the patient moved away with the asymmetrical movement, the teeth, the maxillary teeth and the mandible follow this kind of setting of the maxillary teeth. So, but you can see actually in the mouth, it's an illusion. You have to find out from the trails on the face what is going on with the mandible. This is the seriosity that you have already learned it, and I showed you. Not only the aesthetic but the functional part is also incorrect, that you have to use all the trays and all the lines, and if you can use only the lines and set it the aesthetic part according to the individual lines, you will 100% get a functionally correct smile and functionally correct occlusion as well, without any side effect on the TMG. This is the case what I have already showed you. The second picture in the middle, this is the deprogrammed mandible, and with non-prep veneering and tabletop system, so no preparation or minimum preparation, we can solve this kind of a problem. So you should look at the before and the after picture, how this face has already been rebuilt with muscles movement. So this is the deprogramming. Please learn about that. We have already written articles as well, so you can find on the net as well. So this is the third or fourth or fifth, I don't know, paradigm shift of smile list. So this is the instant deprogramming method. That means no more 6 months, 1 month deprogramming, no more lift gauge, Byton effect, Lucia jig, and other method. We are going to use the patient's muscles movement individually. And the patient's muscles with some kind of slightly guidation show us what is the proper position and relaxed position of the mandible and where should be contact the upper and the lower teeth. Smile is band white, and the software you have to send to the laboratory, to the CAD/CAM process laboratory. Hopefully, I'm sure, and I know India is very, very high tech about this topic. So completing the lab work, and you can get immediately in a three-dimensional way a harmonious smile with any kind of solution. So with direct veneering, with non-pet veneering, with ortho treatment, with mock-up, you can imitate the effect as well. And if you do this one, and if you think logically, you can get functionally corrected mandibular position as well. And additional side effect, but which very positive side effect, that you can get a younger face. You can treat and solve all kind of TMG problem really, and you can get TMG resolution and a balanced body. So if the patient has got acidity or knee pain or some kind of neck problem or tinnitus or something like that, try to solve with smile test movement. I have a lot of experiences with the patient at a great result, really. So uh, so happiness, so the huge happiness you can enjoy day by day if you treat the patient like a smilist way. This is a before after cases of Mona Kakars, because I have a lot of trained trainer in India, Mona Kakar and AJ Kakar and all the others use this method with really great success. And you can see the patient 20th of March and 22 of March, how big the difference is between the before and the after posture if we set the mandible with a stabilizer, smiley stabilizer into the proper and relaxed position. And also one example, it's you can see the view. It's also a really great sign and trails for the dentist, a smiley dentist as an inspector. If the patient's view is very going up, that means it's a stage of, for example, 9, 10, so a maximum stage of TNG problem. And if you set the mandible in its proper position, you will see that whole the body posture, we are getting closer to the balance or getting back to the balance posture, and the view, it's closer to the horizon. So it's very nice. And let us look at the summary. So Smilist, it's really a very new method. It's from my heart, from my knowledge. I don't know how it came from my mind. I'm sure that it came from above to heal really the patient in Smilist way and in an effective way with full of rules and in a conscious way. It can be learned in a very easy way in our courses. So we won't stop this knowledge, because I'm sure this is going to change the dentistry, the thinking, the approach, to see how we see the patient, not only the smile and single tooth, but the smile and as a functional part in our body system. And if you're concentrating on the function and smile using the software, using this individuality and the rules, you can change your patient's life immediately, because as the balance in the body revealed, energy is also start to move, and this patient's life is completely changing. So my aim is to spread this method with the help of you. So thank you very much for your kind understanding and for your kind invitation. And I hope you will enjoy this lecture. This is my special and really nice pianist in Hungary. So change lives and use Smiley's method. And I hope we'll meet very soon. So thank you very much for your kind attention.
Thank you, Maria. A fascinating presentation once again. And I'm sure there is so much everybody has in their minds, but I doubt whether we can really we don't have much of questions which have come up. People are thinking, they are stunned, they are possibly not realizing what are the implications. So we will, I just would like to tell all the viewers that if there's anything that you would like to know more about Maria or about Smiley's, you're free to get in touch with me at any point of time, and I'm always there to sort any issues. Mona is always there to sort any issues. Mona, would you like to say a couple of words?
No, I don't think so. Maria has said it all. Thank you for a wonderful presentation, Maria.
So I
Thank
would
you
like
so
to
much.
give Maria a certificate of appreciation from IICD. So here is the certificate. They're supposed to put it up on display here, but we'll email it to you. Here is the certificate.
Thank you so much.
Thank you, Maria.